The CDC and the American Academy of Pediatrics recommend children stay on track with routine vaccinations. This is National Infant Immunization Week, highlighting the importance of protecting children from vaccine-preventable diseases. Joining me is Dr. Ashley Schumacher with Mercy Pediatric Clinic. Thank you so much for joining us, Dr. Schumacher. We appreciate it.
Yeah, thank you for having me.
Let's get started with what would you say to parents who might be worried about whether vaccines are safe?
The short answer is yes, immunizations are very safe. I will say that social media and the internet has led to a significant amount of misinformation and lies about the safety of vaccines, and so I encourage families to get their information from reputable sources such as the CDC, the FAAP, which is the American Academy of Pediatrics website, instead of a couple of words that they're seeing on like a Facebook post. Reading the articles can be important too, and understanding what they mean, asking their pediatrician. But generally, you know, these immunizations undergo significant testing in the lab, multiple phases of clinical trials prior to their release and use in children.
And talk about the recommended schedule for these childhood vaccines.
So it can be a bit complicated, but at 2, 4, and 6 months, for sure, they get their first set of immunizations. There's boosters and other new things around toddler years, between 12 to 18 months, and then in school age and teenage years too. But the CDC, again, has the full immunization schedule and what vaccines that includes.
Some people might be wondering, why do vaccines start so early?
Yeah. No, that's a great question. I feel like sometimes people are a little bit nervous to, you know, start poking their infant, but when babies are born, their immune systems are completely inexperienced, right? They have not had the time to build up defenses against these really significant and severe diseases, and so it's important to protect them as soon as we can because they're the most vulnerable.
What do you tell parents about why these childhood vaccines, immunizations, are necessary?
In the 1950s and the 1960s, parents were lining up to get the MMR shot, you know, and the polio vaccines for their children. They saw the devastating effects, the deaths, and the permanent disability from these diseases, and we don't see those things anymore. I don't see chickenpox, I don't see polio because of the significant impact and efficacy of these vaccines. And so to continue that and to protect our children as best as we can, it's extremely important to stay up to date.
And you mentioned MMR. We're seeing an increase in measles cases nationwide. The CDC is reporting 7 outbreaks so far this year. Now, as a comparison, there were 4 total outbreaks reported last year. So what should parents know about the risk of measles?
Yeah, so we have really good data to show that being immunized against MMR is very protective. It's about 97% effective. And so we know that the fewer children that are immunized, the more risk we have for disease. And so making sure that as soon as your child can receive that MMR vaccine starting around 12 months, that we do so.
And of course, if you do have any questions, talk to people you trust, doctors, pediatricians.
Exactly, of course.
All right, Dr. Ashley Schumacher with Mercy Pediatric Clinic. Thanks so much for being here.
Thanks for having me. I appreciate it.